Right. I was really intrigued by the concept and the process that led us to having Bill 17 in front of us now. As I'm sure that speakers previous to me, oh, shoot, I bet you I don't have that actual dialogue, was the report from the Honourable Member for Edmonton Rutherford, Putting People First, Recommendations for an Alberta Health Act. And a number of physicians were worked on that committee, and I think there was some patient reps, et cetera, et cetera. And after some initial criticism that the stakeholders were individually chosen, that process got opened up, and I think in the end a fair number of people did participate, despite the challenges of trying to participate over the summer months when it's very difficult to get people together and to be able to inform them that something's happening because people's attention are in other places and they're often out of town for periods of time. So from that, we get this, this new act. And essentially there's three pieces in this act: the preamble, the concept of a health charter, and the concept of a health advocate. And overriding all of this is the adoption or change from having a health act, or rather several health acts, because they would now all be repealed, and we're repealing a number of them. Sorry, I'm just trying to find out which ones we're repealing here. And it's not popping to mind, so I'm going to move on. But what's happening in this bill is that we, aside from stating a number of motherhood statements in the preamble, the idea of the charter, and the health advocate, all other future decisions will be made by the minister or cabinet, known in legislative language as the Lieutenant Governor and Council, or could be made by a ministerial order. So it doesn't come back in front of this House again. It makes it very, very hard for Albertans to find out what's going on, to find out that a change is being considered, and to find how they would give input into that change. So I started to look at a couple of things. And the first thing was I was really intrigued by the idea of a charter, because, as you know, I'm a real constitutional and administrative law amateur. And I'm really interested in how, when you set something out in that kind of a system, how things proceed from it. And I was very interested in how our new Canadian Constitution came into being, and the Charter of Rights and Freedoms that came with it. So I was trying to figure out if you could have a charter that didn't confer any rights and wasn't able to be challenged in court. And so I looked for a couple of different definitions. All of them talk about rights. So from the Oxford Dictionary, we get a charter is a written statement of the rights of a specified group of people. Again, the word rights is right in there. The rights of a specified group of people. Something is being conferred upon them that is very finite, and you can compare against it. They have it. So I also looked, I mean, there's a number of other definitions if you care, but I mean, it's about, you know, you can hire something, or you can grant a charter or make a chartered corporation, for example. So there's a couple of other definitions, but when you're actually talking about creating a charter, it confers rights. That's the Oxford. But some people don't like the Oxford. So I went to the Webster, Merriam-Webster. And Merriam-Webster, well, more or less the same thing, charter, a grant or guarantee of rights, franchises, or privileges from the sovereign power of a state or country. And then it talks about the civic charter again, which I mentioned previously. And then the thing about hiring a ship or some part of it, or a travel arrangement. So I may have checked one more, because you know how thorough I am. Nope. Nope. You don't get anything else. You get those two. That's the English and the American versions of charter. So clearly, a charter, and calling something a charter, is supposed to have rights with it. So what we have here, there are no rights. There's nothing in here that confers a right. When we look at what calls a health charter here, it says it's establishing a health charter to guide. So again, it's not enforceable. A guide is not something that you can say, you didn't do this right. A guide is a suggestion, but it's not an order. And this is to guide these various groups that are listed. And then it talks about recognizing that health is a partnership between, and then it names a number of different groups, individuals, families, communities, etc. And also that this health charter that isn't a charter should acknowledge the impact of a health status, an individual's health status and other things upon interacting with the system. But it can't be used to limit access to health services. And I've gone through the other parts of this, and there's 5 sections on it. None of this talks about conferring any kind of a right, nor does it confer any kind of a guarantee. It does not, it actually specifically does not allow a cause of action or other legal enforceable claim or a proceeding in any court to be brought against as a result of this charter. So it's not a charter. It's a guideline that isn't enforceable. My goodness, that's not exactly a step forward in healthcare delivery. A guide that isn't enforceable. So, frankly, I just have a hard time taking that seriously. And it's clearly not meant to be taken seriously. It's not enforceable and doesn't grant anything.